Hello, everyone, and welcome to the second episode of the Hyper IgM podcast. In today's episode, I have a conversation with a fellow patient, Simon. Simon is 12 years old, lives in Utah, and is currently living with hyper IgM. In this episode, Simon speaks about what it's like living with hyper IgM and all of its challenges. Enjoy the episode. Hello, everybody, and welcome to the second episode of our Hyper IgM podcast. In today's episode, our guest is Simon. How are you doing today, Simon?
Good, how are you?
I'm good, thank you. So, before we get into it, for our viewers that don't already know what hyper IgM syndrome is, hyper IgM is a 1 in a million rare disease that causes a person's immune system to not function properly. People with hyper IgM are unable to make antibodies, which means that if a person with hyper IgM gets sick, they may have a very hard time fighting off the infection and can get very ill. Hyper IgM patients are also at a higher risk of developing cancer. Without a stem cell transplant, life expectancy for a person with hyper IgM is an average of 30 years old. However, some do live into their 40s or 50s. So, without further ado, let's jump right into our interview. So, Simon, why don't you tell us a little bit about yourself, if you have any hobbies or what you like to do in your spare time?
I like a lot of sports and I play a lot of basketball and football. I have played baseball, but I don't really play it anymore.
Gotcha. And you were telling me before that you live in Utah, so you guys got a good skiing up there, right?
Yeah. Yeah, we
Yeah.
like skiing a lot.
Yeah, I'm jealous of that little perk of Utah. So do you remember at what age you really became aware of hyper IgM syndrome? Like, obviously you always had it, but do you know what age you started thinking about it and really being like, oh, this is what I have?
Um, no, not really. I've always felt like I already always knew what it was. Like that like people without hyper IgM, have more stuff to help them, with their immune system.
Yeah, right. So you feel like it's kind of always been like a part of you and that you've
Yeah.
always just kind of been aware of it. Yeah. Yeah, I mean, for me, I feel like I sort of started becoming aware of it more at post transplant for me. As we'll get into, Simon, you didn't have a transplant, so this is obviously going to be different for you. But
Yeah.
after I got out of transplant, when my immune system was still developing, I had a bunch of restrictions and I had to wear gloves everywhere I could. I didn't want to risk infection, so I feel like that's when my mind sort of really became aware of it. Obviously in the hospital, I knew something was wrong with me, but I didn't really know what it was or really understand it at all. But I feel like that's when I really started knowing about it.
Mhm.
And since you haven't had a transplant, can you give a little insight into what it's really like living with hyper IgM? What do you have any day-to-day struggles that it causes or anything like that?
I mean, I get sinus infections a lot, but I
Mm.
just recently had a surgery a couple of months ago, or last month actually. So, and that it wasn't that bad. And then I just get weekly infusions,
Mm.
so I have to get
Yeah,
lots.
yeah. So that surgery was to prevent you from getting sinus infections. Is that right?
Yeah, cause
Interesting.
it would
Yeah,
just
go ahead.
sit in my sinuses and not work. But then they just
Right.
cleared a bunch of stuff out because there was a couple bumps inside my nose.
Gotcha. Okay, so yeah, right, because you haven't gotten transplanted, you have a hard time fighting off the
Yeah,
infection, right? Yeah.
yeah.
And so circling back to you mentioned infusions. For those of you who don't know, infusions provide the antibodies that patients with hyper IgM can't make through either an IV at the hospital or at home.
Mhm.
So does that bother you at all having to do these infusions, or has it just really like meshed in with your like life? Like, has it just become part
Yeah,
of
like
your?
it's just always what I do. Like
So it's like your routine, like brushing your
yeah,
teeth, like same kind of.
yeah. Like
Yeah.
I don't remember when I didn't do them. Like, cause
Hmm.
I think like my parents started doing them when I was like 8 months old. So I've like
Oh,
no
so
memory of
you've
like not doing it.
yeah. So you really just that's just yeah.
Yeah,
Huh. It's
just like what
interesting
happened.
how like yeah we can be so young and we just start doing
Mhm.
things. That's crazy.
Yeah.
Um. So, what do you think is the most challenging part about living with hyper IgM? Now, for someone like me looking in, I'd like see the infusions and I'm like, whoa, that's like crazy. But really, I really like you. Obviously, you're just used to it. So
Yeah.
for me, looking at that, it probably doesn't. That just doesn't correspond with how you would
Mhm.
view it.
Yeah,
So,
cause
what do you
like
think's the challenging part?
probably like with cryptosporidium, like it's a really bad like bug or like sickness that would be a lot way more harmful to us than like other people. Cause so I can't go to like a bunch of pool parties and stuff. And, like that's kind of hard.
Right, yeah. So that actually brings me actually before I get into the next question, um I can relate to that a bit because when I was coming out of transplant and my immune system wasn't fully developed yet, I
Mhm.
had all of these sort of restrictions. Like I could only drink out of bottled water because of that,
Yeah.
and we always had to. And we have a filter installed in our house on our
Yeah, we
sink
do.
that
Yeah,
is
we do too.
from yeah, right. Yeah, that
Yeah.
is which I still use to this day. It's just kind of
Mhm.
a habit for me, really. Which kind of goes back to your infusions, where it's like all of my life I've been drinking bottled water, filtered water. I still don't drink from the tap. So
Yeah.
it's interesting how like that stuff just it all comes together. No matter if I had a transplant and you didn't, still all kind of relates.
Mhm.
So going back to like you said, you mentioned not being able to go to pool parties. Is there anything else in specific that you just can't do because of hyper IgM that really bothers you at all?
Um, Probably like boating, cause like a bunch of my friends will like go boating and go wakeboarding, and like that's kind of hard. Like they've invited me, but I'm like, oh no, I can't go. But like only
Yeah.
like my good friends like know that I have hyper IgM.
Yeah. So actually expanding on the whole friends idea, when I try to explain to my friends what I had, what hyper IgM is, none of them can really grasp it and they're always like, "Oh, did you have cancer?" Like they can't really, they don't really know and understandably so. I mean, it's a 1 in a million rare disease. But do you have a hard time explaining it to your friends as well? I mean, I'm sure it's more relevant for you because you currently still live with it.
Yeah. What I just say, like normal, like you have like IgGs, IgAs, and IgMs. I only make IgMs, so I have to get infused with IgGs, but I can't get IgAs because that's just like something I can't have.
Hmm. Okay. So do you think that explaining it to them like that, like, I mean, like, because you have it right now, do you think that makes it easier for them to like comprehend?
Um, yeah, probably, but like how you said like, oh, did you have, like your friends have said like, oh, do you have cancer? Like,
Mm-hmm.
I like get numbing cream that like goes on the back of my arms, and like whenever, like sometimes I'll do it like on Mondays, and and when I hang out with them, they're just like, oh, do you have diabetes? And I'm like,
Hmm.
no, it's just like numbing cream.
And what is that numbing cream for?
It's for the infusions. So my mom does them, and so there's like these purple like shots, and she has to like take off the numbing cream, clean it, and then she sticks it on. And it is kind of like if like what diabetes, like, the thing looks like,
Yeah,
sort
like
of.
they're the pumps that they wear
Yeah,
on their. Yeah,
yeah,
yeah.
kind of looks like
Okay.
that.
And one more question on the topic about like friends. Do you think that it's important for your friends to really understand what you have? Because coming from my perspective, I can go like my whole friendship with somebody just not mentioning it ever. And they would have no like they would never know. For you it's different. So what do you think about that?
Well, like, not like a bunch of my, like, just like friends that, like, I don't really hang out with, like, I just know them.
Mm-hmm.
But then, like, my really good friends that I hang out with a lot, and that, like, just, like, I've most, so in, like, my good friend group, I have, like, 5 people in there, and I've known them all since kindergarten except for one, and they came into my school in 3rd grade. So, and I've just, like, they've, like, always known.
Hmm. Yeah. So like it's kind of like yeah, like for me, I have like three friends that like I feel like really understand it, and then like two more kind of like aware of it, but it never comes in to conversation or it has an effect on anything ever. So I'm sure it's interesting for your friends also like having such a rare friend. I mean, 1 in a million rare chance disease, and also like going back, 1 in a million rare chance disease. So besides this podcast, have you met any other kids that either had hyper IgM or are currently living with it?
Yes. Like, I know a lot of people actually, because it's just like almost a lot of people in my family has it. So I didn't know that it was that rare until like pretty recently, like 2 years ago. Because
Hmm.
like two of my cousins have it, my uncle has it, my great uncle had it, but he died from it.
Mm. That's yeah,
And like got
sad.
sick and had liver failure.
Yeah, like for me, obviously, I'm part of the Hyper IgM Foundation, so I've come in contact with a bunch of kids, but nowhere near. I mean, I mean, not your whole family, but a lot of your family members have it, which that's crazy to me because I've really like only seen, I don't know, maybe like like 5 kids maybe that have it. Just remembering off the top of my head, that's crazy to me. And also, do you feel like that strengthens your bond with your family members because a lot of you have it?
Yeah, like me and my uncle and one of my cousins, he's in 5th grade, and like he'll talk to me about it. Like we'll talk to each other about it. Like that sometimes it can be really hard, but like yeah, it's just something that we'll have.
Yeah, I mean, I feel like as bad as hyper IgM is for me, also it strengthened the bond between me and my parents because I had to go through transplant. I spent so much time with them in that little tiny hospital room. I feel like we've really not bonded over it, but bonded because of it. Um, and I feel like that definitely has actually benefited me a lot. Which, as bad as hyper IgM is, there's always positives. I feel like that can come out of it.
One of my cousins, he is like the 16-year-old. He um he doesn't like do what me and my cousin do. Our uncle also does it. They just get IVs.
And is there any stress for you that comes out of having hyper IgM? Because, like, from my perspective, like, because you've said about how frequently you get infections and stuff like that, I'd be very careful. If I feel like if I still was living with it, so does that like cause any stress at all and interfere with things?
Um, well, like not really, but like sometimes, cause like last year, well, not last year, the year before, um 2022, I had to go to the ER a lot up up in Salt Lake for primary children's, cause I it just hurt so bad, like all up on my face, like over my eyes and under my
Mm-hmm.
eyes, and that just hurt really bad. And like
Yeah.
sometimes I'm afraid if that's gonna happen again. Like or like I mean, but I skipped a lot of school.
Yeah, so it's like, yeah. Yeah. Yeah, that's terrible.
hmm
That you had to go through that. Um and do you feel like you being so like susceptible to these infections and stuff, do you feel like it has any effect on your parents, or has hyper IgM as a whole affected your parents, or are they like used to it because of your family's extended history with it?
I mean, my dad, like, like I, I think that they're worried, that they like still like don't really like they're like, oh no, like what if he gets sick again, or like what if this happens, but like my mom isn't like as bad because her brother like grew up with it.
So she's been around it her whole
But
life, really.
yeah, she's been around it. But then he would also just like stay in his room and draw because he's an artist now.
Hmm. Okay. Okay. Interesting. Yeah.
Yeah.
I feel like for me, I mean, I'm sure it definitely impacted them while I was going through it. I'm sure that that put a ton of stress and anxiety on them especially while I was going through transplant. I feel like now, because it's really not like at the forefront of our lives anymore, I feel like it probably doesn't affect them. Obviously, I've never really asked them directly, but from
Mm,
what I see, that's what I think.
yeah. Like not as much as it has
Yeah, right. Yeah,
before. Mhm.
yeah. And Simon, do you have siblings?
Yeah. So I have four siblings that
Wow.
all live with me, and I'm the second oldest. And my sister's almost 15 now. My
Hmm.
older
Okay.
sister, and then I have um, younger twins, and then a younger sister.
So obviously, I'd assume that your older sister probably does know all about hyper IgM because she's been with you for this long. Do all of your siblings know about like what you have, or have a full understanding, or do any of them have it as well?
I believe they do. None of my siblings do, like have it too as well.
Hmm.
But like all like our cousin has two of our cousins has it. Um one of our second cousins has it, our uncle has it. So they've been around it like all their lives. They've just always known like I believe that they all like know what it is and like what happened and like what the restrictions are cuz um like today my we were like me and my mom were like going through some of the questions. And
Hmm.
so my and when she asks um like do you have any siblings, do they like do they know what it is? And then we started talking, and then like I said like yeah, and then she said do they have any restrictions? And my older sister's over here, and she's like we can't go to any of the places because I mean they can go to like their friends' parties, but like
Yeah.
sometimes when I'm like at my cousin's house, like they'll go to like a local pool or something. But my
Yep.
grandma has a pool, and like we have to be careful, but it's like a really big pool, and like we all are safe around it. And so that's one of the safe things, like one of the
Yeah.
good safe things that's around me.
And do you feel like you having hyper IgM has affected your siblings in any way? Like, I know you mentioned that sometimes they can't go to places they want to go, but anything more like serious than that, or
Um,
just like surface level?
I mean, I think my older sister's been like stressed that like what's gonna happen, cause like when I was sick, um, 2 years ago, I think she was like worried because I could tell she was worried, and like like I was in our guest room upstairs, and
Hmm.
like she would come see me, get me like a drink and something. She would say like, "Are you okay?" And I could kind of tell that she was worried, like
Yeah.
that she was kind of worried, like what would happen to me.
Yeah. I'm sure it's hard on all of them, really, but it's good to see how supportive they are whenever you have a are sick or have an infection or something or hardship or something like that. It's
Yeah,
great to see. And do you think hyper IgM has affected like who you are as a person? Um, like growing up having it, do you think that that's changed you as like who you are today at all?
probably like I would like people to like look at the Hyper IgM Foundation, like recognize it. Like I know like a lot of people have like donated to it. Like it would be kind of cool if like someone like actually famous like watched like the podcast and like
Well,
um
hopefully,
yeah, and like
if you're
they're
someone
like,
famous
oh,
out there, please. And speaking of being famous, has hyper IgM made you want to like do? Has it affected what you want to do when you grow up as like as your job or something, or made you want to do more volunteer work or anything like that?
yeah. So like I have um my like I used to want to like be a piano player because I play piano really well. But
Hmm.
like over the years, like seeing the people that have helped me like in the ER and stuff, like I've thought like, oh, maybe I want to be like an ER doctor or something, like a doctor or like someone that helps people.
Yeah. Again, going back to the positives of hyper IgM, I mean, that you said that it makes you want to help people, and we always need more people like that in
Yeah.
in our world. I mean, we need there's always room for someone to be helpful and for someone to make a difference in the community or anything like that. So it's great that you've let it build you up instead of pushing you back down, which is great to see. And which also leads me into saying how hyper IgM, the fight that both of us, that I had to go through and that you're still going through with hyper IgM, has really helped me go about my other day-to-day activities, school especially, just really like put me in a better mindset because I feel like what I have gone through just can't compare to whatever I'm going through now. So I feel like it really does give me sort of a mental boost of like strength. And I think we are almost ready to wrap it up. So Simon, do you have anything else you would like to share with us today?
We need more people that help people and like more people that will donate.
I agree.
Like, cause there's like not a bunch of people like that. Cause like people with a lot of money, and
Yeah.
usually they just use it for themselves. I mean, there is some good people out there that like that like help and donate like a bunch. Like Michael Jordan donated like $3 million to a bunch of foundations and stuff, and I thought that was pretty cool when I saw that
Yeah.
in the
So
news.
we need more people like Michael Jordan is just more people to think about other people, be more selfless.
Mhm.
Yeah, I agree. And I'd also think that like we kind of stand as a testament to like perseverance, and especially you because you're still living with it. I only had to live with it for a couple of years, much shorter time than you had to, obviously. But I feel like it's great for us to be out here and just so that other people that maybe they're not going through something as like medically serious as what I had and what you still do have, but just I feel like people can hopefully I the goal of this podcast is to not only spread awareness for hyper IgM, but to inspire others as well to persevere through whatever they might be going through in their day to day lives. So I feel
Mhm.
like it's great. Yeah.
Yeah.
So, guys, I think that will bring us to a close. Thank you, Simon, very much. We had a very good conversation. Thank you for coming on here. Much appreciated.
Thank you.
And make sure to stay tuned for the next episode. Bye, everyone. Thank you for listening. Be sure to follow or subscribe to our podcast, rate or like this episode, and share. It means a lot. Stay tuned for more.